my foster siblings, and many others, family, friends, their lives are what they are now because of my dad. And I don't ever want to think that he died as a number or a statistic. He was a human being. He had a busy life. He deserved so much better, as did every other member who has passed in that home and every other home across this country.
Moira, I'm going to go because the Prime Minister is speaking. Again, my condolences about your father, Stanley, and to your whole family. Thanks for speaking with us, Moira. Here is the Prime Minister of Canada.
Today, we're announcing more help for more Canadians.
Oh, that's fine. I didn't notice
This
it.
includes topping up the pay of essential workers. At the same time, we'll also be expanding the Canada Emergency Response Benefit to reach people who are earning some income, as well as for seasonal workers who are facing no jobs, and for those who've run out of EI recently. And a little later, I'll have some news about where we are with testing. Au Parlement, vous m'avez entendu parler
in
des
Parliament,
contributions.
you heard me talk about the contributions of the largest generation, people who grew up and fought in World War II. Now, right across the country, the last members of this generation are now living in seniors' homes and long-term care facilities. The truth is tragic and worrisome. These are the places where we look after our seniors, and yet they are particularly vulnerable to COVID-19. This is something I want to address with the premiers during a discussion tomorrow evening. We must all do better. We must all show leadership to support those seniors who built this country. To begin with, our government will be working with the provinces and territories to increase the pay of our essential workers earning less than $2,500 a month, and the same applies to long-term facility workers.
About the contributions of the greatest generation, who grew up during the Depression and fought through the Second World War. Today, across the country, the last members of this generation live in nursing homes and long-term care facilities. The uncomfortable and tragic truth is that the very places that care for our elderly are the most vulnerable to COVID-19. I will be addressing this with premiers tomorrow night. We all need to do better. We all need to take leadership for the seniors who've built this country. Our government will work with the provinces and territories to boost wages for essential workers who are making under $2,500 a month, like those in our long-term care facilities. For many workers looking after the most vulnerable Canadians, including seniors and those with disabilities, we know conditions have gotten more difficult over the past weeks, and you need support right now. Tomorrow, in our weekly meeting, I will discuss with provincial and territorial leaders the importance of getting this wage boost in place as quickly as possible. As we face an unprecedented threat to public health, you are our most important line of defense. We will do whatever we can to help you do your job and support you through this time. En mars, notre gouvernement
In March, our government introduced the Canada Emergency Response Benefit. This measure is part of a plan that we put in place to ensure that everyone can receive the necessary help to come through this difficult period. Millions of Canadians have already received the benefit, but we know that many other people were not eligible, and yet they still need help. So today, we will be relaxing the criteria to allow even more Canadians to benefit from it. If you earn $1,000 a month or less, you can now receive the Canada Emergency Response Benefit, because many people do not work as many hours as before, and others must adjust to the reality of contract or gig work. Workers who have run out of EI benefits recently will also be able able to receive the benefit. And across the country, many people will not have any seasonal work this year because of the pandemic, and therefore the CERB will also be available to them. This is a difficult context as well for creators and artists right across the country. Cultural venues are closed and work is rare. Minister Guilbeault has heard from artists who are asking that copyright for their work before the crisis happened not make them ineligible for the CERB. And therefore, at these anxious times, artists continue to help us reflect on life and dream. They bring sunshine into our daily lives, and we are very grateful for that.
Today, I can announce that we are expanding the Canada Emergency Response Benefit to include people making up to $1,000 a month, seasonal workers, and people whose EI has recently run out. Maybe you're a volunteer firefighter or a contractor who can pick up some shifts, or you have a part-time job in a grocery store. Even if you're still working or if you want to start working again, you probably need help in making ends meet. So if you earn $1,000 or less a month, you'll now be able to apply for the CERB. If you were expecting a seasonal job that isn't coming because of COVID-19, you'll now be able to apply. And if you've run out of EI since January 1st, you can now apply for the CERB as well. And for others who still need help, including post-secondary students and businesses worried about commercial rent, we'll have more to say to you very soon. No matter who you are or where you live, we're in your corner. After accepting
an initial request for help from the CAF from Nunavut, Quebec sent us a request for the North Shore, and I can confirm that the Canadian Rangers will be there to lend a hand.
Accepted the first demand for help from the Canadian Armed Forces for Nunavik, the government of Quebec has sent us a second request for Basse-Côte-Nord. I can confirm that the Canadian Rangers will be there to provide support. I want to thank our women and men in uniform and the families who serve alongside them for all that they do. Whenever we need you most, you're always there for us. Par moment,
from time to time, we may feel overwhelmed by events. We're in a situation that may seem unreal, and it's not always easy to deal with everything happening around us. This week, the government is launching a new portal that will bring together mental health resources and will make them available to Canadians. You can go to canada.ca or use the application Canada COVID-19 to talk to someone. There is no reason to feel embarrassed about that. The important thing is to get the help you need.
If you're feeling overwhelmed, know that you aren't alone. And there are people who can help. We have launched a mental health portal at canada.ca and through the Canada COVID-19 app, where you can go to find support. So if you need to, please reach out. We'll be there for each other. Finally, we have more news today to share on testing. Lumen Ultra from New Brunswick, with whom we signed a contract, is now ramping up production to supply enough COVID-19 test chemicals to meet the weekly demand in all provinces. And in the last few days, we received a new batch of swabs to make sure every province has the supplies they need to keep testing. Whether it's reagents or test kits, we are ensuring that Canada has the tools to fight this virus. Tomorrow, I'll also be speaking with the other G7 leaders about continuing to coordinate a strong and effective global response to this pandemic.
The business Lumen Ultra New Brunswick is now ramping up its production capacity in order to provide enough chemicals for COVID-19 test kits and tests that need to be conducted in the provinces and territories. Up until now, we have also received a new batch of swabs. I know that everyone wants to know when life will go back to normal, but the reality is that we cannot give you a specific date. But this is what we know. For this to be over, people have to stay home. We have to limit our movements as much as possible and keep a distance of 2 meters from others. And if everyone does his or her part, we will come through this together. Thank you.
Thank you, Prime Minister. We'll now go to the phone for questions. There will be one question and one follow-up. Operator.
Thank you. Merci. La première question, Michel Lamarche, TVA Nouvelles, à vous.
Good morning, Mr. Trudeau. I'd like to hear you comment on the discussions with Quebec with respect to the intervention of the Canadian Armed Forces in long-term care facilities. We're told that people from the medical division may not be enough, so are the troops or is the CAF ready to intervene? Those discussions continue with Quebec and the other provinces to see how we can help even more. We have developed a portal where people of experience, with medical experience or special experience, can provide their help, and we shared that portal with all the provinces. We continue to work directly with Quebec on their requests for more resources, and we will continue to work with Quebec on that. A follow-up? Yes, you're not really answering the question. I understand that you're working on this, but are there discussions? Quebec said yesterday, we need people on the ground now. Why is nothing being done right now? And other than medical personnel, can you send in military personnel to serve meals, pick up garbage? What exactly can you do immediately? Well, immediately, right now, we are working with Quebec as to how we can help. We know that there are needs out there in Quebec and right across the country, and that's why we're working with the provinces to provide them wherever possible the resources that they require. We are there to be their partners. We are there to pursue these discussions and bring in help as quickly as possible if it's necessary.
Merci. Prochaine question. Operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Good morning, Mr. Trudeau. I'd like you to comment on the decision by the United States to freeze its funding for the World Health Organization. My priority and the priority of our government right now is to do everything we can to protect Canadians and ensure the health and safety of people right across the country. And that means working with experts here in Canada and around the world, and we will continue to do that important work for Canadians.
One of the things that is so important for Canada to do is to continue to work with local experts and international experts to do everything we can to fight this virus and keep Canadians safe and protected. That's what we will continue to do.
Je veux bien, mais
craignez-vous
que ça ait des conséquences?
But are you not concerned that this will have consequences for the global fight against COVID-19? Well, tomorrow I will have an opportunity to speak to other G7 leaders to talk about how we can properly coordinate our efforts and continue to work together to fight COVID-19. And of course, coordinate our approach based on science and evidence and working with experts around the world.
Merci. Prochaine question.
Thank you. Merci. The next question, Justin Ling, Freelance. Please go ahead.
Hi there, Prime Minister. Obviously, I've been asking you for about a month now about the state of Canada's prisons. You've promised repeatedly that new measures would be coming, that the Minister of Public Safety would be announcing new cooperation with the Parole Board. We still haven't seen any of that. So is this just not a priority? Is nothing coming? Is there even going to be a decision about those inmates who are being released on day passes, like other provinces have done, to release them temporarily? Is there any announcement coming?
We have made significant efforts and taken significant steps to ensure that our incarcerated population is kept as safe as possible from COVID-19. There are a number of measures that we've taken. We continue to look at more measures. We're coordinating with the provinces on these efforts as well. We know that this is an area where we've seen challenges in terms of outbreaks, but we also are continuing to step up our efforts every day to ensure that all Canadians are protected.
So you're stepping up your efforts. The directive from the commissioner last week said that corrections officers should wear face masks. The Corrections Canada has previously said they're providing soap and hand sanitizer. By all accounts, those things aren't happening. So if the work you're doing isn't happening, do you need to change tack? And finally, have you totally abandoned the idea of releasing federal inmates?
There have been a number of discussions at the highest levels about various processes that need to be put in place. There have been a reduction in transfers, in issues that have put potentially people who work there and people who are incarcerated there more at risk. We have taken a number of measures. We will continue to look at taking more measures, and we will ensure that the measures in place are properly followed.
We recognize that it's important to ensure that we protect people who work in our federal institutions as well as inmates. And that's why we have taken specific measures, and we are continuing to monitor the situation to see that they're followed. And of course, we will seek other ways to ensure the protection of those people.
Merci. One more question on the phone, operator.
Thank you. Merci. Next question, Jim Bronskill, Canadian Press. Please go ahead.
Good morning, Prime Minister. Social distancing advice differs from jurisdiction to jurisdiction, from Vancouver closing Stanley Park to cars, so more people can walk around it, to Ottawa's local experts telling people to basically not chat on their driveway with neighbors. In light of this, how do you sustain public confidence in social distancing measures?
I think we've been very, very clear that the best way to prevent further spread of COVID-19 is to stay home as much as possible. If you have to go out infrequently and keep 2 meters distance from each other and wash your hands aggressively and often. These are the things that we're asking all Canadians to do. Across the country, we recognize that different communities are in different situations, that there are different local health experts giving advice that is suitable to that particular context. We make sure that everyone is getting the message that we all have to do our part to fight COVID-19, and that means engaging in social distancing, but it is perfectly normal that there be slight variances in approaches in a pandemic that is manifesting itself in very different ways in different parts of the country. soulignons à quel point c'est important de prendre
saying how important it is to take actions in order to protect yourself and to ensure that COVID-19 will not spread further. That means staying home as much as possible, not going out unless it's absolutely necessary, and also keeping a 2-meter distance from others if you must, and regularly and aggressively washing your hands. Now, of course, in various regions of the country, there are different situations as regards the pandemic, so there are variations in experts' recommendations, but the major recommendation remains. We must do everything we can to keep practicing physical distancing and prevent the further spread of COVID-19.
On the World Health Organization, how much total financial support is Canada now providing to the organization? And has the U.S. president ever put any pressure on Canada to either boost or, of late, reduce its support for the organization?
Canada's support for the World Health Organization is in the tens of millions of dollars. I think we've increased it recently, but I can make sure that someone has the exact numbers for you or for the media. No, the President hasn't made any direct asks or indirect asks of Canada around that. Okay. Je crois que on appuie
I believe our support for the WHO is in the order of $10 million per year. I know we recently increased our contribution as a result of the pandemic, but I will be sure that you have a specific answer to that in the coming hours. And no, the President has not asked Canada to do anything with respect to funding for the WHO.
Glenn McGregor, CTV News. Prime Minister, you've repeatedly said how much Canada has relied on WHO for information about what's happening around the world. Are you satisfied the organization sufficiently interrogated the information coming out of China in the early days of the pandemic? We know now a lot of the information was either false or misleading, especially about human-to-human transmission. Do you think they did a good job on how they handled that information and shared it with other countries?
I think what we need to remember is the path through this pandemic is for us to base ourselves on science, on the recommendations of experts, on the data and the knowledge that we've gathered from past pandemics and past health issues to apply to these situations. And that's why we will always continue to work with experts, both domestically and internationally, to take the best advice possible in keeping Canadians safe. Of course, in the coming months and years, there will be many reflections on various institutions and systems, both domestically and internationally, on how we can improve our response, how we can learn from things we could have done better in this process. These are things that will come in the coming times. Right now, our focus needs to be on doing the best we can right now to protect Canadians.
We're hearing about potential shortages of medication used for painkilling and sedation before patients are intubated and put on ventilators. What's happening at the federal level to ensure that there's a continued supply of those medications?
Public Health Canada and Procurement Canada are working together to ensure the steady supply of essential medications to Canada, both related to COVID-19 and not. We recognize that this is a global health crisis, so there are challenges, but Canada has a very strong pharmaceutical industry. We have very strong relationships around the world on getting medication and necessary supplies, and we will continue to do everything we can to ensure that Canadians get what they need. Nous avons nos équipes et nos ministères en train de
Our teams and our departments are working with the provinces and our partners around the world to ensure that there will be the proper availability of medications and essential goods. And we will always do whatever we need to do to ensure that Canadians have the products and medications they need. We know that we're in a global crisis at this time, but Canada will always have the equipment it needs for Canadians.
Tom Perry with CBC News. On the WHO, you were just asked this, but the Conservatives and others have raised concerns that the WHO was too willing to take the word of the Chinese regime early on in the pandemic. Do you share those concerns?
I think there's obviously reflections that we have to have going forward, and we have to make sure that we are doing everything we can to keep Canadians safe. And that is our focus right now. What can we do now? What do we need to do in the coming weeks? How do we lean on experts in international institutions and in partner countries around the world who are making recommendations alongside our domestic experts on what we need to do now? There will be plenty of time as we move forward to reflect on challenges that were faced in the past. We need to learn and move forward as quickly as we can.
And you said yesterday that you're talking to the provinces and territories about eventually reopening the economy. Can you say what work specifically you're doing with the provinces and territories to do this? And you also said that there are different points along the spectrum of the pandemic. So do you see when things do start returning to normal, is that going to be on a provincial level, a local level, a national level? How's it going to work?
Well, we recognize that this pandemic is going through very different phases at different points, different places across the country. One size fits all will not work for a country as diverse as Canada, but the overarching principles are extremely important. We know, regardless of where you are in the country, we need to get through this first wave before we can start releasing some of the rules around social distancing and staying at home. How that release works will vary from region to region, from industry to industry, and coordination at the federal level on how we do that is going to be very important. But with spring coming, people are looking outside, wanting to get out, wanting this to be over. I understand that. It will be weeks more before we can seriously consider loosening the restrictions. It would be terrible if we were to release restrictions too early and find out that we're suddenly back in another big wave of COVID-19 and everything we've gone through up to now would have been for nothing, because we'll find ourselves once again in the same situation. If we hold on through this period now, as long as we have to, once we are able to release things, we will be able to better control how things move forward. But as impatient as people are getting all across the country, we need to continue to hold on if what we're doing now as sacrifices are going to be worth it. Okay.
I recognize that people want to know when this is going to be over and when we can relax the rules on social distancing and kickstart our economy again. The reality is that if we start to relax those restrictions too quickly, we may very soon find ourselves in the same situation as now, or even worse, with a new wave coming almost immediately. And in that case, everything we will have done and what we're doing now will have been for naught. Now people are making sacrifices right now. They're going through very difficult times, and we're going to have to continue to do that for a number of weeks yet in order to be ready to properly manage and be vigilant as we gradually come out of this. Yes, we'll have to coordinate that with the provinces, but we will especially have to remain in this phase for a while yet to ensure that when we can relax the restrictions, we will not end up in the same situation a few months later.
Prime Minister Janet Silver, Global News. I know you've just spoken about a coordinated effort and some more patience needed in terms of reopening the economy. But just to follow up on that, I'm wondering whether you envision when that happens that workers will be tested before they return to work.
Obviously, when we are able to loosen the controls on social distancing and start to reopen our economy, massive, rapid testing on a very wide-scale basis will be an essential part of the vigilance we have to have. There will also be a need for very aggressive contact tracing whenever there is a case that appears. We are going to have to be extremely quick about responding to any future outbreaks in future waves. But in order to get to that point, we need to continue doing what we are doing now for many more weeks. We cannot be in a rush to get things going again, because if we move too quickly to loosen all these controls, everything we're doing now might have been for nothing. We'll find ourselves in another peak just as bad as this one or worse, and it will be extremely damaging both to how Canadians feel, but also to our economy. That's why we are going to be extremely careful about any steps towards reopening the economy. It seems like over the past days, people are talking about, oh, when we reopen this, we'll do this, we'll reopen that. It's not happening yet. If we reopen too soon, everything we're doing now might be for nothing. We are making sacrifices. We're there for each other. We need to hold on still. And then, once we're ready, once we feel we're through, once the experts are telling us that we can talk about reopening the economy a little bit, we will take very careful steps and do that. Okay. Je reconnais
I realize that for a number of days, people have been talking about opening up the economy again and getting back to work and being able to go outside. And obviously, with spring here, people are anxious to do that. But I have to tell you, we are not at that stage yet. We're far from that stage. If we reopen things too quickly, we could very easily find ourselves in an even worse situation than right now. And all we will have done, and everything we've been doing for the last few weeks, will have been for nothing, and we'll have to start all over again. We do not want that to happen. So please be patient. Please continue to show the kind of discipline we've seen in you Canadians. Let's continue to protect our healthcare workers and do everything we can to protect our seniors. And we will get through this, but we have to stay the course.
Prime Minister, as we see the horrific stories unfold each day across the country with regards to long-term care facilities, people getting sick, people being abandoned, many dying, if your mom was in one of these facilities, what would you do?
I can't imagine what so many Canadians are going through right now with loved ones who are suffering, people they can't even visit right now, seniors worried about falling ill and not being able to see their kids and grandkids again. These are the things that we need to focus on as a country. That is what I will be speaking with premiers about tomorrow night, how the federal government can support the premiers in their responsibility in their jurisdiction over long-term care facilities and senior care, to make sure that we are supporting the heroes who are working in extraordinarily difficult situations for very low pay, to continue that work safely and mostly to keep our elders safe. This is a situation where, as a society, as a country, we need to pull together to be there for our elders who built this country. That's what we're going to focus on in the coming days.
We recognize that it's absolutely essential to be there for our seniors and to be there as well for people who are receiving only very modest salaries in order to help our seniors. We must continue to be there for them, and that's what I will be addressing with the premiers tomorrow, to see how we can support the people who are working with our seniors and elderly, and also ensure that they remain healthy and safe. They are going through very difficult times. They're anxious, they're afraid, and they are uncertain as to whether they're going to be able to see their children or their grandchildren. And as a society, we have to do better for them. Radio-Canada. Now, with respect to the long-term care facilities, the Army could possibly help out. Now, do you want to send in only medical personnel, or are you thinking about sending in other people who are now part of the CAF to help out the personnel there who are totally overwhelmed? We are currently in discussions with Quebec and the other provinces to see how we can provide them with more resources. As I said, I received 2 specific requests from Quebec to send in the CAF to Nunavik and the Lower North Shore, and we will continue to work with the province and respond to any request that is made with respect to anything. We are there to help and work with the provinces as they see fit.
There have been 2 requests so far by Quebec to send in support from the Canadian Armed Forces in both Nunavik in northern Quebec and in Basse-Côte-Nord. These are things that we are doing. As any more requests come in, we will look to support Quebec or other provinces who are asking for help from the federal government, regardless of what that help looks like and what they're asking us. We will be there to help out as provinces need help.
Sur la pandémie comme telle, vous dites qu'il faut
Back
continuer
to
de
the
faire ça pour
pandemic,
arrêter
you're
la
saying we
pandémie
have to
mental.
continue to do what we're doing to stop the pandemic. But right now, we're trying to stop the spread. But until there's collective immunization or a vaccine, and it will take a long time before we get a vaccine, are there scenarios your government is looking at in terms of collective immunization? And this would be for certain sectors to be able to start up and perhaps protect certain groups. Well, our priority is to avoid seeing our healthcare system overwhelmed and a mortality rate of 2 or 3 going from 2 or 3% to 10% as we saw in other countries. That is absolutely what we want to avoid. So yes, we are slowing the spread of the virus, and we're also developing methods and technical capacities in terms of testing and the ability to do quick contact tracing so that we know who may have been infected at one point or another. And we are developing these tools in order to be extremely vigilant once we've come through this first wave of COVID-19, so that we can perhaps relax some of the restrictions on citizens and on the economy. But at the same time, we know that as long as there is no vaccine, we will have to continue to be extremely vigilant and to respond very quickly if there's a resurgence of COVID-19. And it's all of those reflections that are ongoing at this point. But as I've said, we will need to remain in this phase of severe restrictions for a while in order to have that ability and to be able to look at the next steps.
We know that until there is a vaccine for COVID-19, we are going to have to remain extremely vigilant as a world, as a country, to resurgences, even once this first wave is through. Once we see this first wave pass through Canada without having overwhelmed our healthcare system and our healthcare workers, as we certainly hope, we will be able to look very carefully at how, with extraordinary vigilance and very rapid response times to any future resurgences of the virus, we can carefully re-engage in certain sectors of our economy in loosening up the restrictions. But we are not there yet. We have to be through this first wave sufficiently to be able to know that we have the capacity to stamp out and restrict any future outbreaks as they come along. That means technology, that means better testing capacities, that means continued vigilance, not just by governments, but by all Canadians to preventing it. We're still a number of weeks away from that, but we are reflecting on what that looks like and what sort of technology and medical solutions will be necessary. We will get through this together. But for now, we need to stay strong in our social distancing measures and by staying at home. Merci beaucoup tout le monde.
We now join the following program in progress.